Thank you, Prashant, and good morning. Welcome to all of you to this workshop. My job is to really set the stage, tell you about what we're trying to accomplish through this framework, and of course tell you who the National Academy of Medicine, or IOM, is, how and we involved with this initiative. So welcome to this financing workshop. And as you know, you're here because of the crisis in Ebola. And we all know that countless lives and major socio-economic impact in particularly 3 West African countries, but as well as many others, and have really much global impact. And so we all agree that we need a plan for next outbreak, a plan that will help us mitigate the disastrous outcome of a infectious epidemic outbreak or a pandemic for that matter. Something that can help us better prepared, better coordinated, and certainly better respond. And we're here because the Institute of Medicine, or now also called the National Academy of Medicine, has been approached by multinational agencies, foundations, NGOs, and many others to really bring together an initiative to look at a framework, if you will, a global architecture for mitigating such risk in the future. As you heard from Prashant, this workshop is one of 4, and I'll say a few words about this. But before I get into the next step, I'd just like to thank a few individuals. Certainly, Cece Mandaka-Shah, Patrick Kelly, Jillian Buckley, and Rachel Pidlick, and of course, many others, my Chief of Staff, Morgan Kendrick, and Catherine Bortner. So let me begin by telling you who we are, and this is going to be very brief, so you can understand why, in fact, we've been asked to do this, and then quickly get into the background of this framework. So we were founded as the health arm of the National Academy of Sciences, which was chartered by Congress in 1863 as an independent organization outside of government, but work closely with the government, with experts and distinguished scientists to advise, in fact, the government on issues related to science and arts in those days. Obviously, during the Civil War and through several wars, I think the National Academy of Sciences has been critically important in providing not only advice, but coming up with very important solutions that I won't have time to tell you about. But about 45 years ago, health and medicine was so important that, in fact, they created an arm called the Institute of Medicine. And so July 1, through a constitutional change, we're now the National Academy of Medicine, alongside with the National Academy of Sciences, the parent organization, the National Academy of Engineering. Our mission is advisor to the nation, but of course, over the years, as I tell you, we are a lot more, we're also very active globally as well. And it embraces the health of people everywhere. We've certainly been seen as one of the, shall we say, gold standards of advice. The New York Times describes us as the most esteemed authoritative advisor on issues of health and medicine that can transform thinking around the world. So what do? We do 2 things really well. One, of course, is we have access to people like you, the very best minds, the brightest minds. We can convene people, when needed, around really important critical issues for conversation, discourse, and advice. Second is that we provide evidence-based reports, reports which in fact are very much compliant with government and many other agency standards by which we can influence Congress, government agencies, etc. In fact, 50% of our work are commissioned frequently by the US Congress or by agencies of the government. So these reports have been very impactful. And of course, as I said, we are actually not only US, but very global. Here's an example of the various activities we have done globally. It's a very small selection of examples. Under Patrick Kelly's leadership, we have a unit, a section on global health, and the forum on actual microbial threats that's been around for 18 years. So you can imagine how this issue continues to pop up left and right. We also have a forum under the Health Sciences Policy Board on medical preparedness for catastrophic events since 2007. We've had multiple workshops on H1N1 as well as on Ebola. And of course, our report's been central that influences the PEPFAR policies and decisions. So you can see many such things. So the fact is, what I want to do is to give you that background that in fact we have a very global stage, and this is not a US initiative. This is a multinational initiative in which we, NAM, and I will play a secretarial role to help to organize this commission to move forward very important recommendations. Now, so why Ebola? Well, you all know that a year and a half now, we've had witnessed some of the deadliest outbreak seen around the world, and it's destroyed lives, families, have major socioeconomic impact everywhere, particularly in the three countries, Guinea, Liberia, and Sierra Leone. And of course, we all know that we need to act on this, and the question is, what went wrong? And we won't have time to go over this today. Suffice to say, for you, you have to think about the financial aspect of it. But one can certainly say that at almost every level, international, country community level, things have not gone well. Certainly in international, a delay to recognize a magnitude outbreak, limited financial resources, and the ability to mobilize those dollars that's needed for acute responses to such an outbreak. A lack of coordination mechanism between public-private organizations. Certainly we hear that from a lot of NGOs and others, and the absence of an easily mobilized reserve pool of funds, which is what we hope you talk about quite a bit. At the country level, you can see there's a reluctance for different countries to publicly recognize severity outbreak because there's great impact on the economy, and sometimes even obstruction to early notification, as you hear from Margaret Chan and others, and limited trained workforce, infrastructure, supplies in medicine, coordinating mechanism, poor understanding of community culture and traditions. And finally, it's really important to remember that what happens really happens on the ground, and the community is critical in any response. And I think in this case, it's well recognized the community mistrusted the government or outside agencies. At the same time, there's a very slow understanding of the cultural issues of community to work along with them in areas of surveillance, burial, many others. So I came back from a number of meetings, which I'll mention briefly to you. And of course, these were big topics for those workshops. So let's talk about the need for a global health risk framework, the need for an architecture to reduce risk and mitigate the next big crisis. Before it occurs, we have to have view and resources and roles for responding. We have to have a successful containment once we have outbreaks, and of course we have a coordinated response. I think the critical issue is we need to learn now before memories fade. And as Margaret Chan always says, that people say lessons learned, but in fact it's frequently lessons observed, but we haven't really made that much difference over the several of the major pandemics. So this slide tells you how this all started. In the fall of 2014, just about a year ago, when I had breakfast with my good friend Jim Kim, we discussed about this issue. And of course, it occurred to us that we need an independent assessment and not only lessons learned, but what to do in the future. Quickly, we got support from Judith Rodin, the Rockefeller Foundation president, to join the three of us. And then initially we had a planning with World Bank, Rockefeller, joined by WHO. We held 2 meetings in December, and getting to zero Ebola cases chaired by Margaret Chan, the Director General of WHO, followed by a March meeting which planned, in fact, this whole framework. And we've been very fortunate. To me, to a large extent, it provides us the credibility and legitimacy of doing this because, look, 8 different foundations all joined in right away to say, you must do this. While there may be UN reports and WHO reports, we also greatly support an independent comprehensive report. So Paul Allen Foundation, Ford Foundation, Gates, Mai Wing Lau from Hong Kong, Moore, Rockefeller, USAID, and Wellcome Trust. And of course, we are very grateful for their support for this initiative. Now, what is this initiative? I want you to focus on the middle column, which says Independent Synthetic Deliberative Global Commission. It is a commission. It's a multinational commission. It's a commission that's independent from really any specific government or organization. It's brought together under the umbrella of this initiative, supported by the sponsors. And the chair of the commission, in fact, is here, Peter Sands. I'm sure you all know, and you're going to hear from him. We're so glad that Peter can do this. He's got a vice chair, which is Professor Tomori from Nigeria. And I'll tell you just a little bit about the commissioners in a few minutes. Their job is to put together a definitive report that, as you see here, to talk about, to advise the world about how preparedness for response in the future. And as you can see, this commission is driven by 4 work streams, because in the earlier work it was assessed that these were the 4 big items that we must address. And of course there are many more, but I think these are the big ones. One is on governance of global health. Second is, of course, your one in terms of pandemic financing. Third is how to strengthen health systems from public health, surveillance to healthcare delivery. And fourth is medical products, research and development. Now, I will tell you that you're now the 3rd workshop, because this one happened in Ghana just a few weeks ago. It was wildly successful. Engagement, of course, African leaders, world leaders from everywhere, and community leaders, civil society, to talk about what we must do to invest in this area. I just came back from Hong Kong on this one here, which obviously uniquely brings together industry, academia, government, and NGOs to talk about how to actually incentivize vaccine development, medical products development. What about clinical trials, and how can we actually move much faster in the future? Yours is the 3rd one, which is by no means but it's probably extremely important. And certainly tonight you're going to hear from Dr. Kim to welcome you at least. He's not involved with this initiative because we're independent, certainly, but he should be given credit to push this thing forward. And of course, in London next week, we have a big meeting and looking at governance. So the Commission, I think it's important to point out that this is a multinational initiative, not a U.S. initiative. So 25% or less are U.S., but in fact, you can see our leader, Peter Sands from UK, is chair, and we're so grateful. And they already have, the commissions already met, and I can see how he's going to really make a great difference moving this forward. And as mentioned, Dr. Tomori, but the commission is not only spanning multiple continents and multiple countries, but expertise in finance and law and health, civil society, private sector. And I think you may recognize many of the names in here, which I won't have time to go over. So their job is to synthesize the output from the work streams, such as one here, and put together a comprehensive report. This is overseen by International Oversight Group, which is co-chaired by myself and Judith Roden, but it certainly has many important participants, such as Paul Pullman from Unilever, Jeremy Farrar from Wellcome Trust, Chris Elias from the Gates Foundation, and many others whom I'm sure you're familiar with, including Dr. Xiang Xiaoming from China, and Dr. Omi-san from Japan, and many other places. And so this group is to oversee the process by giving the charge to the Commission, overseeing the processes and review process, and assuring, in fact, a properly conducted, no-conflict process. Today, you're going to talk about the finance work stream. And I'm just putting up here to remind you that the charge is to look at specifications for financing mechanisms required to achieve global infectious disease surveillance and to assure sustainable response capacity or capability to emerging infectious disease events with a minimum amount of transactional costs and delays. So really many really important issues. What in fact is the financing mechanism, and how do we actually have it ready so that there's a minimum amount of transactional cost delays when such a thing happens. So finally, I want to tell you about the timeline of this initiative. The Commission met in July. Of course, it took us a lot of time to get together this whole framework. And someone said to me, this is really quite amazing. Look at the size and scope of this initiative. And I can tell you, it's huge, because spending 3 days in Hong Kong and R&D, we really had so much to discuss about mechanisms for incentive, mechanisms of stockpiling, mechanisms of research, etc. And I can imagine you're going to have the same. So each one will have lots of information put together. And I think what we have been very blessed with, of course, is great staff. This is what we do. This is how we pull them together. So as I said, we already had the Resilient Health System meeting in Ghana, the R&D in Hong Kong. We're having the pandemic financing here, and next week in London. The commissioners are going to take your deliberations, and they will meet again in September, end of September, and then in November, and they'll eventually work really hard. I guess they lock themselves in a room and come up with, in fact, with a consensus report, which hopefully by the end of November, early December. Now, we're very cognizant of the fact there are many other initiatives around this area. I mean, there's no shortage if you pick up the newspaper to read about opinions, etc. I think what we hope to accomplish is an independent, comprehensive, objective set of recommendations that can be useful. But perhaps equally important is to be coordinated with other initiatives, such as the Barbara Stocking's report that just came out, and of course the UN high-level panel that is ongoing. We're in close coordination with them. In fact, we've met with them and we discuss with them frequently. Suffice to say that I think that what we may be different in the sense is the, breadth of engagement, but also in areas such as R&D and maybe financing, which we can take it into a deeper dive. So clearly, the hope is that our report will actually be considered along the UN high-level panel as they put forward their report. Importantly, as Peter will tell you, I mean, all of us feel, particularly the Oversight group, is dissemination. There's not a shortage of reports and previous lessons learned from H1N1, but nothing much has changed. So much of our role is to think about how to make sure that what you do reaches the hands or the tables of the decision makers, such as at UN, such as G7, G20. And I can tell you we have made lots of inroads and discussion and likely to be on the many agenda, led by, because Peter and others, to be important for people to consider these, because political will is going to be needed in order to make any changes going forward. So that's what I've got here. Gillian was very worried I was going to take too much time. I bet you I'd made less than 20 minutes, Gillian. So anyway, the point is we welcome all of you here. Thank you so much. What you're going to do is so important for the world. And I think that your willingness to volunteer your time to really make a healthier and better world is greatly appreciated by all. Thank you. Back to you, Prashant.